Hey guys, my name is Chris Munwiller and my disease report is on rabies. So I found a case study where in June of 2014, a middle-aged man cut his thumb with a knife while he was working. And he went to the hospital, he got stitches and gauze for it, and he was sent home. But about 2 weeks later, a relative of his was bitten by a rabid dog. And while the man was helping his relative, a mix of blood and the saliva from the dog bite, went into the man's wound. The relative of his went to the hospital. He got the rabies shot. He got immune globulin for rabies. And he was fine. The relative of him was fine. But the man in question, he started feeling symptoms of rabies about 2 months later, after that dog bite incident. He wasn't even bitten by the dog, but he got rabies. His symptoms started off where he had trouble sleeping. He felt like it was crawling in his skin. He started to become delirious as every light was too bright to look at, and every glass of water was too difficult to swallow. His pharynx muscles would spasm. They would have these intense spasms every time he would try to drink a glass of water. And he would start sweating excessively and salivating uncontrollably. And so he went to the hospital because he needed fluids. The doctors there diagnosed him with rabies, and eventually he slipped into a coma and suffered cardiac arrest as a result of the rabies attacking his system, and he died. From the time that the symptoms began to the time that he died, that was only a 10-day window. So what is rabies? Rabies is an RNA virus whose genus, Lysovirus, is derived from the goddess of madness and rage. It's definitely appropriate for the symptoms that we're dealing with. It's bullet-shaped, and the RNA interior is covered by layers of these very stable nucleoproteins, surrounded all by that lipid envelope. Rabies is usually acquired through a bite, but as we saw in our case study, it can also just be from saliva. Or for very rare cases, there have actually been cases of people who would eat the tissue of the brain tissue or the nervous tissue of an infected animal without cooking it thoroughly. And they would end up getting infected. So infection starts with either the bite or the eating of the nervous tissue, or as we saw, just the saliva getting into a scratch or a opening in the person. And it travels to the nerves, to the muscles and the nerves. And eventually it travels to the spinal cord and the brain, and it causes this inflammation in the brain, which causes these symptoms. Now, there are two types of presentations of symptoms, either the furious type or the paralytic. And we'll discuss these both. Now, for the case study, it was the furious symptoms presentation. This usually begins with skin crawling and not able to sleep properly, having trouble sleeping. And then it goes to those more intense symptoms of delirium and this light sensitivity, hydrophobia, the severe agitation of where everything, even wind, seems to be way to cause an intense reaction in either your muscles and eventually you will slip into a coma. And usually it's by heart failure or lung failure, or a heart attack, that you end up dying because your body simply isn't able to work with those conditions. Now, the paralytic is a lot more subdued. It starts with just paralysis at the site of the bite. The muscles around that bite or that scratch where the saliva got in end up not working anymore. They end up going into a state of paralysis, and then you have the same result of coma and heart attack or lung failure. Now, currently, there is no treatment for rabies once the symptoms have begun. There's no stopping it, essentially. This is one of the only viruses where you actually have about 99.9% death rate once the symptoms have begun. And that's what makes it so scary. But there is hope, because if you catch rabies before the symptoms start, then you're able to administer a rabies vaccine and immune globulin, which you take over a 14-day period of about 4 injections. Unfortunately, in places that are less developed, like in Asia and Africa, you see a lot of deaths from rabies because of the fact that there's less access to these medications, and there aren't many preventative treatments going on. In the US, there's vaccinations among dogs and cats, which happen to be some very prominent spreaders in Asia and Africa. But in America, luckily, we have set the vaccinations accordingly in order to make sure that we actually stop it before those cases begin. To give you an example, of the 59,000 deaths each year from rabies, 98% of these cases are caused by dogs. And luckily, due to the vaccination efforts that the US has done, it's reduced it to only 2 per year, only 2 deaths per year in the US. And all of these cases that are in the US, the ones that don't die, they're mostly caused by either bats or raccoons, not dogs. So in conclusion, it's definitely something that is very sudden. It's not something you want to mess around with. Having those vaccination efforts will definitely help eradicate that disease, at least in the US, as we have seen. And hopefully over time, as preventative measures continue throughout the world And as research develops cheaper and more effective rabies vaccines, uh, the hope that rabies deaths will be a thing of the past grows each year. These are my works cited. Thank you so much for watching.